Hello and welcome to the first of two National Foster Care Month webinars, Implementing Parent Partner Programs and Supporting Reunification. This webinar is being recorded. If you object, you may disconnect at this time. Participants are muted throughout the webinar, but are encouraged to ask questions by typing in the Q&A pod on the right-hand side of the screen. Participants can also obtain today's PowerPoint presentation by clicking the download button on the lower right files pod. We're pleased to offer CEUs for this webinar. In order to qualify for CEUs, please ensure that you are logged in at the beginning of the webinar and log out at the end. If you have technical problems during the presentation, please feel free to type into the Q&A pod or contact roshana.roach@icfi.com. Following this presentation, you will receive an email with the webinar evaluation and CEU links. At this time, I would like to turn the presentation over to Taffy Compain of the Children's Bureau. Please go ahead.
Thank you so much. Good afternoon. My name is Taffy Compain, and I'm the National Foster Care Specialist at the Children's Bureau.
A screenshot of the 2016 National Foster Care Month webpage containing a photo of foster parents hugging their young daughter.
May is National Foster Care Month, and it's a time to focus on enhancing the lives of children in foster care. This year's theme is Honoring, Uniting, Celebrating Families, and centers on the reunification of families. As you'll note, the Children's Bureau, with the support of the Child Welfare Information Gateway and numerous partners representing stakeholders in child welfare, including those alumni of foster care, foster parents, and collaborating agencies, have developed a robust website with the many resources relevant to foster care, and hope that you're able to visit us at https://www.childwelfare.gov/foster-care-month. Today's exciting webinar is titled Implementing Parent Partner Programs and Supporting Reunification. This webinar, hosted by the Capacity Building Center for States in collaboration with the Children's Bureau, will provide an overview of parent-partner programs and explore how these programs benefit parents and children and ultimately support reunification. On behalf of the Children's Bureau, thank you for joining us today. I'd like to turn it over to Jennifer.
Thank you, Taffy. Hello, everyone. My name is Jennifer Marcelli. I'm a Program Area Manager with the Center for States. And before we get started on today's presentation, I'm going to briefly go over today's agenda. As we just heard from Taffy Compain from the Children's Bureau. Next, I'll do introductions of our presenters, and then we will go into the presentation on implementing parent-partner programs, and we'll finish up with question and answers. Again, as you heard from Taffy Compain, who is the National Foster Care Specialist at the Children's Bureau, and then you will hear from two folks, Corey Best, who is a Family Engagement Manager with Healthy Start Coalition of Flagler and Volusia Counties, Inc. in Florida, and Denise Moore, the Parent Partner Coordinator in Des Moines, Iowa. The purpose of today's webinar is to discuss the components of Parent Partner programs that facilitate positive change. We'll also discuss how Parent Partner mentors guide and motivate parents in utilizing services in order to have constructive interactions with the child welfare system and courts, and of course support reunification. The objectives of today's webinar are to describe the role of the parent partner within the child welfare system, identify strategies to build community relationships, define and change organizational culture, as well as identify strategies for effective parent partner program design and implementation, and convey the positive impact the parent-partner approach has on safe reunification, families, and the child welfare system. With that, I'm going to turn it over to Corey Best for our presentation. Corey?
Thank you, Jennifer. Thank you, Taffy, for the introduction. Good afternoon, everyone. Once again, my name is Corey Best. I'm a Family Engagement Manager with Healthy Start here in Florida. Our work began with just a mere notion of family involvement. We have evolved tremendously since then, and on the screen you'll see sort of how we embarked upon the work of creating parent-partner programs within our community. We began with one, identifying what the challenges were. There are differences between technical adaptive work that actually promotes a transformed system. Before I dive deeper into that, I'd like to just read a quote by Peter Senge, who wrote The Fifth Discipline. And he writes, "The changes required will not only be in our organizations, but in ourselves as well. Only by changing how we think can we change deeply embedded policies and practices. Only by changing how we interact can shared vision, shared understanding, and new capacities for coordinated action be established." That particular quote is profound for our community. As we know, technical work usually comes with perspectives being aligned. There's usually one leader who has the primary responsibility for delegating or assigning the work. The adaptive challenges, however, is when we have no clear solution to the problem. These are legitimate yet competing perspectives at work, and the solution and implementation requires lots of learning. And a part of that learning is we recognize that parents, parent leaders, parent partners can actually help to co-create the work and become a more transformed system. What that looks like is by creating a compelling shared vision, we communicated strong expectations with and for all stakeholders involved. We adopted a leadership continuum that reflects areas of strength. This actually promotes agency, culture, values, and climate changes. I recently had a conversation with a colleague that mentioned his work with parent partners and the adaptive nature in which transformation had occurred. And he said that in the past few years, conversations around the water cooler actually went from more toxic to more positive because we are actively partnering with parents. This transformed system has shifted values once again, and there's a broad participation of parent partners across the continuum. Our organization internally focuses on change. Our organization also encourages cultural innovations, and we also challenge the status quo. Some adaptive work, actually all adaptive work, requires courageous leadership and commitment from the entire community in order to create lasting and positive change. We'll dive a lot deeper into the steps next, and I'll turn this over to Denise Moore, who will give us some insight into how to build steps into capacity for parent partners. Denise?
Thank you, Corey. Good afternoon, everyone. I'm going to talk a little bit about the steps to building capacity to partner. As you can see by the 4 arrows, there's these steps that need to be taken into each category. So we're going to talk about building agency capacity first to partner with families that may focus on varied issues from addressing staff reluctance to acknowledging families as partners to establishing an infrastructure that supports ongoing partnerships. Some of the steps for building agency capacity could be allocating resources to build an infrastructure to support family leaders and staff in their work to build strong partnerships, creating a safe space for parents and staff to meet, share experiences, and in a very intentional way, learn how to authentically partner with each other. Supporting a change in the culture and climate of the child welfare system through use of a strategic communication plan that highlights the value of the parent's voice and how they can assist the system by engaging families. There's also, when we're building family capacity, that's also another step. For parents, the journey from being a service recipient to becoming a family leader and then developing the competencies to serve as a parent partner can be complicated and requires appropriate support. Some steps for building family capacity might be building a strong and diverse pool of family leaders that matches the population being served, providing training for parent partners and child welfare system, family needs, and self-care so they can effectively provide peer-to-peer mentoring, preparing parent partners to deliver presentations and sit at policy tables, and providing ongoing supervision, coaching, and supports to parent partners. At the core of the Parent Partner Program are relationships, not only between parent partners and parents, but also between parent partners and agency staff. There are several established approaches that assist states with building authentic relationships between parents and workers, and the common underlying theme across all these approaches is gaining an understanding of each other's perspectives and establishing respect for the different roles each individual represents in the system. Throughout all these efforts, validating the experience and input from family leaders, the climate and culture of an agency is organically influenced to more positive outcomes for families. Workers are able to see their success stories and are motivated to continue building relationships with parents, which is critical in the success of a family, as well as the parent partners themselves. Parent partners are examples of true change within a family and inspire others to duplicate these interventions. Next slide, please. So I'm going to talk a little bit about who parent partners are. Parent partners have all been consumers of the child welfare services and use their experience to assist families when entering the system. They provide understanding and interpret the needs of the agency to the families they work with. They support families through the process by inspiring hope and guidance. We know that a lot of the families that come to the attention of our child welfare agencies are often come from a world of chaos, and everybody's speaking a foreign language, and they're really lost and confused and very scared. And parent partners are able to guide them through the processes and help them direct them to a path of more successful outcomes. Parent partner programs can be a powerful strategy for overcoming common challenges to family engagement, focusing on family strengths and needs and contributing to positive outcomes for children and families. Support caseworkers by assisting families in realizing their potential and guiding them towards reunification, always focusing on safety, permanency, and the well-being of their children. I think that is one of the experiences that we didn't really intend for, is that the caseworkers and the parent partners themselves building such close relationships. And some of our parent partners now, a lot of their support system comes from the workers that once were their caseworkers, and they're able to see that success and help improve outcomes for other families. They provide a family voice at the system level, and they influences agency culture and climate to support family engagement. Next slide.
Parent partners exemplify advocacy, facilitate trainings and presentations, and collaborate with DHS and child welfare professionals. They also possess a unique and diverse skill set that allows them to establish relationships built on trust and mutual respect with parents.
Parent partners entering child welfare are often fearful and angry, as I spoke about before. Many feel that they are not truly included in the decision-making process, and their most urgent needs for help are not addressed. Parent partners remove the stigma by showing families that they can recover and provide a safe and stable home for their children. The shared experience of the parent partners and parents create an instant connection so that parents can engage in services and move towards meeting the requirements of their case plan. So when a state or a jurisdiction is implementing a parent partner program, you will want them to meet with or have that meeting point as soon as possible when the case opens, so that families are able to move in a direction that will lead them to more successful outcomes. Parent partners provide an understanding of what's being said in meetings, in family team meetings, and in court hearings, so that families are less fearful, and they're able to advocate for themselves and identify any needs that they might have in their case plan. And now I'm going to move over to Corey, and he is going to talk about the role with parents.
Thank you, Denise. It's, as Denise mentioned, the role of the parent partner has multi-facets included. What's critical to note here is that safety of the child is the primary focus of the parent partner. Once again, child safety is number one as we support parents in building their protective capacities. In addition to safety, increased parent voice in decision-making processes. It's critical for parents to recognize that they have more power than they realize, and also that their voice is needed to help direct case plans and help determine what services are effective for their family dynamic. We also connect families to those prevention and early intervention services that will keep their kids safe and also catapult families as they venture the road and journey toward reunification. Unlike many formal services within our communities, parent partners are a non-judgmental and informal support. In my personal experience, I've assisted many parents in recognizing safety concerns and have encouraged them to sort of stagger or delay case plans to avoid increasing the rate of recidivism. Our ultimate goal is permanence, and hopefully that permanence is reunification with the parents. Another huge focus of the parent-partner approach is the parent-partner has a unique capability of understanding various culture. Through understanding the culture of child welfare, we actually raise the staff awareness of culture. This culture can include substance abuse, domestic violence, race, gender. Within our communities, this is also accomplished through staff trainings. I'm charged locally with training staff on how to build healthier relationships with our parents. On the next slide, I'll talk a lot more about the role of the parent partner with agency and staff. In addition to assisting parents achieve various goals, we'll take this from sort of the bottom up. The number one is to focus on supplementing the caseworker's goal. What I mean by supplement is that the parent partner becomes an extension and an arm and another resource for the parent and caseworker. We provide parent-driven training for newly hired staff. We also act as a buffer between parent and staff because oftentimes a parent may have critical challenges and needs, and as the parent partner works informally to build self-advocacy skills, we help shape strategically a parent's voice to build healthier relationships with staff. And Denise hit it. She mentioned the fact that over time, these relationships are nourished and healthy and they blossom. We also inform staff of the most effective community resources to provide services or guide a family's course toward reunification. And one of the most effective is we assist with the cultural awareness. Various cultures, as I mentioned before, from substance abuse through ethnic differences. I've attended a few trainings in Iowa, and what you'll notice over the course of our presentation today is a continuum of a parent-partner approach that has been fully implemented in one state, which is Iowa, and our parent-partner approach here in Florida, which is newly implemented and in our 3-year pilot and planning phases. The focus of the work is to sync with one another. And, at the end of the day, as we work with staff, parents are more supported, staff has support that makes reunification an achievable goal, and the parent partner becomes an added resource to reduce out-of-home stay. Staff also has an added benefit, and that is that the diminishments actually occur and offer parents services that are strength-based and trauma-informed. As we transition, we'll move into how we develop a parent-partner program, and Denise will give you some insight into that. Denise?
A Venn diagram shows 3 parent-partner program models. 1. Child welfare agency staff. 2. Parent-partner programs contracted with nonprofit organizations. And 3. Legal aid staff.
Thank you. So I'm going to talk a little bit about a parent-partner program models. As you can see by the 3 circles interconnected, we have child welfare agency staff contracted by nonprofit organizations and legal aid staff. Although all the parent-partner program models provide peer-to-peer support, they differ in who employs the parent partners and other characteristics. There are 3 program models that have been adopted in the field, as you can see by the different circles. I'm going to talk a little bit about some of the benefits of each of the programs and some of what are the challenges, and then some examples of each of a state that might have one of these program models. So first I'm going to talk about child welfare agency staff, and some of the benefits might be that parent partners have opportunities to learn about current child welfare practices, how caseworkers are working with families and expectations for the families. They also, families begin to engage with their child welfare caseworker because they see parent partners working in collaboration with agency staff. Caseworker perceptions and behaviors towards families often improve as they build relationships with parent partners, as we talked about earlier with changing culture and climate. Some of the challenges of the child welfare agency staff would be families may view the parent partners as part of a system that is working against them, so it would be difficult for them to build them kind of trust-based relationships if they feel like they're sharing, or if the parent partner is sharing personal information with the workers. They have policies in place preventing child welfare agencies from hiring people who have criminal history or in the child abuse registry, although some states may be able to address this through independent contractor processes. As you're developing your parent partner program, you will want to be able to come up with a strategic plan on how to address that issue. Also, parent partners may experience pressure from agency staff for more information as they start building them relationships and start becoming a support system for each other. They would be, their lines of communication are more free. And an example of that is New Hampshire. It has a child welfare practice model. Another one is the nonprofit organization. As Corey said or mentioned, that I am from Iowa, and our state agency has contracted with a nonprofit to implement our parent partner program statewide. And so some of the benefits of that are parent partners are not directly associated with the child welfare agency and are able to engage families more easily. Parent partners understand the child welfare system and assist families with engaging with workers, attorneys, and service providers to ensure successful outcomes, as that's similar with all the rest of the program models as well. And parent partners do not report to caseworkers or write court reports. Some of the challenges is that the physical separation between the child welfare workers and parent partners may make communication more difficult, and it's harder to build any kind of trust-based relationship. Parent partners may not be up to date on current child welfare practices, and they may miss opportunities to open doors for parents they support. And then there's issues of trust or control may emerge between agency staff and parent partners hired by another organization. And I think one way to overcome that challenge is just having intentional interactions and intentional communication plans, and ensuring that our child welfare agency is invested in the recruitment, selection, training of our parent partners, as well as identifying any issues and being a part of the solution in taking care of them. An example, of course, is Iowa and Maine. And then we're going to talk about the legal aid staff, and some of the benefits are that parent partners in the legal field are protected by attorney-client confidentiality. They might be provided training by judicial staff that other program models wouldn't be able to train the parent partners with. And then parent partners in the legal field are able to advocate in court with the assistance of the attorney. Some of these challenges might be that parent partners can be seen as having an adversarial role within the child welfare agency. Parent partners may take on a strong advocacy role, siding with the family, and even when there are significant threats to the safety of children. And parent partners might be subject to testifying and creating documents for the court. An example of that program model is in Washington State. And next slide. We're going to talk a little bit about funding and compensating for parent partners. Parent partners, of course, should be compensated for everything they do. Our parent partners are compensated from their initial meeting, all their face-to-face support, family team meetings, emails, texts, mileage, training expenses. So we compensate them for everything they do. They bring a value and expertise to the conversation, sitting on policy boards. They're compensated as well as for that. They're all at different levels of self-sufficiency, so we want to make sure that we're valuing their expertise and all that they bring into the work that they do. Also, some program funding considerations might be, as Corey will be able to talk a little bit about how it looks in Florida at the very beginning. When we started our program in Iowa, we started out as 4 pilot sites, and each site individually had their kind of own piecing of money that they brought together to, support the program. So they we had also we used grants, we used some federal money that was tailored that we could use, promoting safe and stable space money that was able to use for parent partner programs. We used some child welfare leftover money from previous years that we could put through a decategorization project to solidify that. After years building trust in the Child Welfare Agency, seeing the value of the Parent Partner Program, they have now put it into a budget line within their state budget, so that that every family in the state of Iowa would have access to a parent partner when they first come into the system. So I think it's just looking at kind of different ways that you can support that, but always keeping sustainability in mind. It's heartbreaking to see that when we can't plan for the longevity of the program and making sure that it's supported way beyond that initial pilot site. Our parent partners, I'll talk a little bit about pay structure. Our parent partners now in Iowa are paid on a per case basis. So they get a certain allotment of money for how much time they're spending with families. And then they also get a certain amount of money for attending meetings. They get travel expenses, windshield time. In some of our more rural areas, our parent partners are driving quite a long ways to see their families. So we built in a windshield time piece as well in our pay structure. Would you like to add anything, Corey?
Sure. Thank you for that, Denise. You know, we are, as I mentioned earlier, the challenges often comes when we talk of money, and also we are in our infancy here in Florida. To begin, we took some notes from Iowa, and Iowa shared information with us. We started with the end in mind thanks to their guidance, and we hired parent partners full-time as employees to give them benefits. And the goal for the future is to actually look at ways for those parent partners to become what is commonly known as site coordinators as we expand, and then build their skills with volunteer management, because we will begin to contract with parent partners. As the program expands, it's not feasible for us to think that within, for now, a 4-county area, we would be able to pay benefits and compensate mileage reimbursement, and also provide flexible funding so they can provide concrete support to the families that have their needs, that have their own personal needs. At the moment, our pay structure is we're in partnership with our community partnership, which is our local community-based care organization. They fund the contract. Healthy Start actually supports the approach through providing infrastructure, supervision, and coaching through the parent partner approach. We have now a family engagement department, and the parent partner approach falls under that. Denise will now shift from pay and structure to a little more about leadership in that continuum. Denise?
Effective implementation of a parent-partner program requires a cohesive oversight structure with several levels. Many programs create an organizational structure that includes the support of 6 elements, illustrated on this slide by 6 boxes of different colors. The 6 elements are: 1. Steering Committee, 2. Program Administrator, 3. Program Coordinator, 4. Lead Parent Partner, 5. Clinician, and 6. A network of field leaders and champions.
Thank you. So I'm going to talk about program leadership and oversight. And I think as we develop programs, it is one of the most critical pieces of developing a parent partner program, is to make sure that we have a system in place that's going to develop, to support them parent partners in the work that they do, and then also to help them develop professionally as well, and also that we're including the parent voice in all levels of our program administration. So I'll first talk about the steering committee. And the steering committee is created with the thought that we have parents, providers, child welfare agency administration and frontline workers, community partners, court systems, all sitting at the table to help develop and brainstorm ways to not only promote the program out into the community, but also to support and develop policies and procedures. So that's kind of the two primary functions for a steering committee, is providing program oversight and advising on key decisions, and then also carrying the program out into the community, the court system. I know that when we were first developing our program, that there was key players that we brought on board to be a part of our steering committee, because we knew that we were going to need their assistance in the training of the parent partners and the supporting of the parent partners, and also community partners of how we were going to get them into the community and help them to make them connections so they can help families with the needed community resources. The presence of a child welfare administrator actively involved in both the design and implementation of the parent partner program will signal to the agency staff that this is an agency priority, and it will continue to gain buy-in throughout the whole system. So as we've developed the program, we have leadership at the very top of our child welfare agency that is pushing down, and then we have parent partners kind of pushing from the bottom. So we're meeting in the middle, so the workers are really buying in and being part of that process. And we have amazing relationships with our child welfare administration that supports us and that is always involved at all levels of our program development and implementation. And then I think probably the most critical role is the program coordinator for the parent partners. They are going to be the ones mostly responsible for providing oversight for the parent partners, for supporting them, for helping them to balance their personal life with their new professional roles. They keep track of their training to make sure that all the parent partners are receiving the needed training they have to work with families. They facilitate the matching process. So in our state, when we match, we get a referral form. In most of the state, in some of the in my particular area in Polk County, it's really matched on what are the cultural needs of the family and what is the shared experience of the parent partner in the family, and how do we match them appropriately. So if somebody comes in with domestic violence or substance abuse, we would match them according to whatever issue brought them into the system. Always making sure that, ensuring that we have fidelity to the program model, approving invoices and compensation, and also oversees the collection and monitoring of program data. Another role is our lead parent partners. Our lead parent partners model the expectations for newly hired parent partners. So we have a shadowing and mentoring process. So after our parent partners have completed their initial training, they then go into a mentoring process with our lead parent partners that supports them through the first interactions they have with the family. And we would never send a parent partner out without being totally comfortable with working with families. So it's important that we have that kind of guidance one-on-one as they're out initially working with families. And then also we have a clinician role. So our clinician is a master's level practitioner that typically meets with the parent partners once a month. They address healthy boundaries, triggers that parent partners might be experiencing working in the system, working with the same workers, going into the same courtrooms that maybe their case was in, as well as if they've had experience with substance abuse, they work on all the triggers that might come up. And they also do case reviews with the parent partners. They are also available to work with the parent partners on an individual basis to work on personal issues that they might have related to their home life, sobriety, trauma, grieving, and, of course, self-sufficiency. It is critical throughout this process, and I mentioned it in the steering committee, that we are identifying field leaders and champions to be able to rally agency community supports around the parent partners These relationships, as we've mentioned many times, supports the program and the individual parent partners as they're providing services to the family. So it's absolutely, and some of the relationships are now our parent partners are working with foster parents, they're working in 0 to 3 courts, they're working with our family recovery courts. So our parent partners are building the community relationships that help support them both professionally, helps them build self-esteem and confidence as they're able to do this work. And now I'll turn it over to Corey, and he's going to do a little more conversation about supervision and coaching.
The slide shows 4 interconnected circles representing 4 components that provide support for parent partners. The 4 components are 1. Administrative supervision, 2. Ongoing coaching, 3. Clinical supervision, and 4. Educational and skill building.
Thank you, Denise. As we shift just a little from leadership, as you'll be able to tell, this is all interconnected as the circles demonstrate. We'll focus a lot of energy on what's needed to keep parent partners actually healthy in their work. Part of any jurisdiction's implementation plan, the thought should consist of various activities, skill-building elements. As with any promising practice, the goal is obviously to optimize development of the program's employees and or representatives. Parent partners have a unique situation. Usually these are parents who have been removed from child welfare exposure or directly involved in case plan themselves more than a year or so. So parent partners require the attention, as we will with any staff, when it comes to self-care, professional conduct, reporting obligations, safety, confidentiality, and privacy protocols are all things that we must teach our parent partners. As we improve quality and output, we share the belief that continuous learning opportunities will definitely assist parent partners achieve the greater success. And we'll begin a little with just the admin supervision. As we look at the admin supervision, it creates a bridge between agency and frontline staff. Supervision provides parent partners with a clear understanding of the agency culture, policies, missions, values, including the state practice model. On a deeper level, the admin supervision, as mentioned, can really drill into the professional conduct components. With clinical supervision, it's more than anything, it's all about self-care, recognizing and dealing with secondary vicarious trauma and developing various coping strategies. The benefit of this therapeutic environment is that parent partners actually build healthy relationships amongst themselves. It becomes a community within a community, and that's awesome to witness. As we think more about education and skill building, it's really necessary for us to ensure that there's a training course, a path for parent partners to continue to grow in their profession and in their work with their families. These offerings help maintain unconditional, positive, non-judgmental outlook for staff and parents. And as we help and support parent partners in building these skills, we see that they're able to transmit what's being taught to their parents. And as we know, it's hard for us to transmit anything if we do not possess it ourselves. Denise will talk specifically coming up about a training opportunity through the Center for States. Denise?
Thank you, Glory. So the Center for States Family Empowerment and Leadership Academy is designed to provide training for child welfare agency staff and family leaders, including those interested in serving as parent partners. So the Family Empowerment Academy has been busy working on a curriculum or core training for states to be able to use for parent partner programs. But each state or jurisdiction should design a core training or a training academy and other professional development opportunities for parent partners. So as you're developing your steering committee, this would be a major objective for your steering committee to take on, really establishing what are the trainings that the parent partners are going to need to be effective in their work. Would it be confidentiality? Is it mandatory reporting? We know that it would be also how to navigate the child welfare system, what do the courts look like, what is the language that's going to be used in the courts, what are the name of the court hearings. So that is a piece that every state will have to design their own training development. But in the meantime, this also is the Center for States developing this core program for parent partners as well. And if you go to the next slide, it will show you kind of what FELA's Parent Partner e-learning module is looking at. So it's going to build knowledge and skills in effective peer support to families, roles and responsibilities of parent partners, mentoring skills, ethics, professionalism, and confidentiality, and working with parents from diverse cultural backgrounds and with varying needs. And I think it's important as we develop our core training that we also keep in mind that they're always going to be learning and that they should have access to all trainings that the state might provide through the courts, through the communities, through the provider agencies to help build them professional skills. A lot of our parent partners through this process go on to go back to school, and they go and go into different jobs in the mental health field, substance abuse. So this is really kind of a stepping stone until where they're going to be and how we can develop them skills so they can go on and do wonderful things and become self-sufficient. So the FELA training is going to be live, I believe, in the summer of 2016, so it's coming up, and then people will have access to the training modules through the Center for States. And now I'm going to turn it over to Corey to talk about roles and responsibilities of parent partners. Thank you.
Thank you. We've touched briefly on the parent partner roles and responsibilities. Here I'll try to go a little bit deeper into after we've identified parents, we've established relationships, we've implemented the parent partner approach, we really help to solidify the foundation by working with state, nonprofit, and or community-based organizations to co-create roles and responsibilities for parent partners. And as you can see from our slide there, one is to provide informal peer support to parents within the child welfare system. We actively assist parents with developing goals and connecting to community resources. These goals actually help to support parents during court, team meetings, treatment and recovery, and other community events. Parent partners also, as leaders within their communities, take part in speaking engagement, participate in state-level committees, and co-facilitate trainings to local, state, and national audiences. Developing and articulating these roles actually provide stability, a lot of consistency across the board, and once the roles are determined, we're able to share, build upon, and assess actually what's working. Because going back to the adaptive leadership versus technical work, if we fail to assess what's working, the program may be hindered by whatever reason, and a solid structure can help maintain, as Denise mentioned, sustainability. Another fundamental element to this process is to ensure that there are desired qualifications and or exclusions. And what I mean specifically, usually we have a criteria here in Florida where we would prefer that a parent partner has a closed child welfare case for at least a year. That's up to conversation. We can, we're thinking about maybe minimizing that to 6 to 8 months. Definitely no felonious criminal charges involving severe harm, death to a child or an adult. No criminal activity whatsoever within 5 years. Having these parameters helps support the fact that parent partners have changed their lives and are in position to actually give back to the community by promoting safety, by helping parents achieve reunification through shared lived experience. The pilot phase of our program has been an eye-opener for me. It has taught a lot of soft skills such as humility, self-awareness, a sense of purpose in this work, and the ability to work independently are all skills that we help parent partners hone. And Denise will add more, as she dives deeper into, as we talk more about our cultural responsiveness. And I'd also like to highlight the unspoken role is always to utilize a strength-based, non-judgmental approach and model effective communication with staff. And as we transition, we'll talk a little more about how that works, how these roles and responsibilities help with agencies' cultural responsiveness. Next slide, please. As we know, for many years, researchers, practitioners across the country and world, and professional organizations have voiced concern about the need for culturally competent workforce, as well as programs and services that are designed to be respectful of families' culture. Historically, however, we provide written material in various languages, match participants and providers based on ethnicity and race, and have not incorporated traditional child-rearing practices into program curriculums or child well-being measurements. So the slide here, it gives you somewhat of an indication of the complexity and the responsiveness that we possess as parent partners. One, with Latino and African American families, lesbian, gay, bisexual, or that whole population where parents are questioning parents, or transgender, Native American, immigrant families, complex trauma, and single fathers are all cultures that we respond to through the non-judgmental lens. And as we respond as opposed to react to these cultures, we actually promote cultural humility, meaning we understand another's culture. I do believe that as a father, I'm often amazed by the benefit of working with men to accomplish various goals, whether it be reunification, co-parenting strategies, or what have you. Having a male parent partner increases father engagement in services, and it actually adds a much-needed voice to team meetings, court, staff. The more we recognize that there's a culture of safe and effective parenting by dads, we will continue to see reunification increases. And Denise in Iowa, they have a very unique way of pairing parent partners with various cultures. Denise, would you like to talk a little more about that?
Absolutely. So I think what we do, and what I think that all programs should do is really look at the diversity within your parent partner workforce. So when we are identifying possible different populations for parent partners, or when we're going to get our recommendations from the department on people to be parent partners, we look for the different populations. We know that it's the shared experience of that connects families to parent partners. So if there's a Latino family, we would want a Spanish-speaking parent partner. So we're constantly recruiting for them. We are also gender-specific in Iowa. So our dads, we are constantly recruiting for dads to be able to work with other dads and on down the line. So as we have Native American parent partners, we have African American parent partners, and we also match on their culture and ethnicity, as well as the issues that brought them in. So as much shared experience, it provides an instant connection between the parent partners and the families they're working with. And we know that the experience is different. We look at disproportionality numbers throughout the states and throughout our state, and we know that we need to really make some intentional effort to create that kind of connection between the families and our parent partners.
Thank you, Denise, for that. We'll shift gears a little bit into you mentioned intentionality. As we go to the next slide, you'll see how important relationships are It's critical that we have as many players from our communities involved in this process of not only reunification, better outcomes, but promoting parents, usually a disenfranchised population, to professional growth and development is awesome within our communities. We need the families, we need child welfare agencies, we need the courts, and all members of the communities. I've actually had several questions regarding the exact nature of our work. As we talk about what's needed, it takes courage, perseverance, challenging the status quo, as mentioned before, meaning that wholesome relationships between communities, agencies, parents, and the system must be established before the work can continue. Where and how this happens is amazing, because in my experience, the relationship often begins at the community level. When I say that, and I'm sure Denise can attest to this as well, there are a lot of parents actively doing the work of parent partners in our communities without being recognized or acknowledged. At local resource centers, identifying parents is a way to obtain parent partnerships and buy-in, parent support groups, and other grassroots efforts. This approach requires a lot of innovation, and as we bring this experience to the table, it's helpful that we design and implement prevention and early intervention strategies with the agencies, courts, communities. It's only through collaboration that we move from a child protection system toward more of a child welfare community. And as we wrap up this segment, Denise will specifically highlight the value of engaging community partners.
So community partners, it sounds like we're repeating ourselves, but it's just so critical to the success of the program. Community partners should be brought on board at the design phase with selected community leaders recruited into the steering committee, as we mentioned before, and be prepared to spend time finding the right partners willing to commit to the program and engage them in meaningful ways. So a lot of, I think, the unexpected outcome of our parent partner program was our parent partners are actively involved in their community. So they are out doing volunteer work. They're out in the community. They're doing support groups. They're building relationships with all of our community partners, and it's been critical for, I guess, the Child Welfare Agency to be recognized in that way. So parent partners are really showing the community, look what child welfare did for me. Look how it's changed my life. So, and I don't think that story is told often enough when we think about how families come in and what they've heard on the streets before they come to the attention of the department. It's pretty negative, and the parent partners provide, I guess, a different perspective on what the department has done or the agency has done for them. So through that process, they cultivate relationships with the community partners. It also gives them a knowledge of the community services and resources that they're able to give to their families and to and to the rest of the support group within our parent partner program. So they support training and professional development activities. When we first started out, we had very little money. Our community partners would pick up and bring our parent partners in, provide training for them. Substance abuse. We had mental health clinicians that were willing to come and work with our parent partners on our clinician piece, and them kind of substance abuse, helping parent partners understand substance abuse, and all them trainings we can roll into the engagement of the community partners. Also, they provide in-kind donations. They provided meeting space, flip charts, trainings, as we mentioned before. And also, if the partnerships between universities and other organizations can help you support data collection, assessment, and evaluations for your program that is critical to sustain it as well as to expand it. So you will want to take some time to really develop them forms to meet the needs of the program, and so you're able to show actual outcomes when it comes to funding or to looking for funding or funding needs. And so we kind of talked about all the different, or some of the different components. There's other components as well. But now we wanted to, I wanted to reach back to the Parent Partner Navigator, which that has been developed by the center and our family consultants, and it's a web-based tool that will assist states and jurisdictions to develop and implement a Parent Partner program. So some of it, some of the components of it, every component that we talked to you about today and others will be included in our Navigator. States and jurisdictions will be able to access the Navigator, click on a link, and learn about what other states are doing or get tools to help them develop their own program. There will also be a readiness assessment to assess whether your agency is ready to build a Parent Partner program and what steps can be taken, as we talked about earlier, to build capacity for that readiness. And then there will also be a program manual that will have templates so that as you're developing or other states are developing the Parent Partner program, they can access that program manual and use them templates in there as tools to build their own program specific to their needs. And so now I want to move over and talk a little bit about the role of Parent Partner programs and reunification. So Parent Partner programs offer many things to families. I think some critical elements is the early engagement. We know child welfare guidelines do not match up to substance abuse or mental health timeframes. So we need to get families moving from the very beginning of their case and moving down a path to successful outcomes. So we really start from the very beginning when a family first comes to the attention of a child welfare agency and come up with a plan. When are they going to see their kids? What are the steps? If it's substance abuse, we know we need to get you an evaluation. The Parent Partners have resources to help assist families in getting that substance abuse evaluation or the mental health evaluation. So families are on a path right from the beginning. If we give them too much time to languish in the system, we know that because of the federal requirements and our state requirements, we're not going to be able to engage them in services in time for them to have successful outcomes such as reunification. So early engagement is critical to success with families. The peer-to-peer mentoring, as we've mentioned before, families come in alone, they're scared, they come from a world of chaos. A parent partner comes and says, I came from the same place you do, and today I'm able to come back and help other families, and I want to walk through this whole process with you. And they walk from that very initial meeting. They help them to understand what's being said in court hearings, in family meetings, family team meetings. They also help families to be able to self-advocate for themselves so appropriately, so they're working with families behind the scenes to really identify what are some of the strengths that are happening right now and what are some of the needs, what's not working well, so you're able to say it appropriately to your team and build that kind of team approach around families, because we know that's critical to the success of families. Reduction of social isolation kind of goes with that. The families that have been successful, there's always been somebody that believed in them, and they've had a team around them, and we know that kind of team approach helps families be successful. So we're constantly trying to engage, build relationships and engage workers with families and families with their in-home worker, families with their attorney, because we know that them are critical to the success of their family. And then linking parents to services. Our parent partners are very aware of all the community resources that are available, and are constantly matching our families with them services. So, next slide. So early research indicates the relevance of parent-partner programs in reunification. So we in Iowa have had evaluation or a study done on us. We were granted, we had a grant from the Midwest Child Welfare Implementation Center, and they did a study with our parent-partner program also in moving it to statewide as well. But they created documents, we created surveys based on the protective factors, and we took administrative data from our child welfare agency and we compared it to our parent partners and to see what the outcomes were. And our parent partners, the families with parent partners were more likely to be reunified and they were less likely to come back into the system. There's also been research done in Contra Costa, California that shows that families with parent partners are 4 times more likely to be reunified. So as we're continuing to build evidence-based programs, we know that we're now a promising practice and that we're still doing the study in Iowa as well, so we can continue to build on that. But it's definitely showing that families are reunified more often. They provide a bridge between parents, foster caregivers, staff, and the courts. We're constantly refocusing parents on how to move to the next step and to not get bogged down with certain aspects of their case and to really just keep moving forward and work towards having their kids return home to them. And then our parent partners are, as the case proceeds through they're constantly working with them to build them informal supports because they know how it feels when everybody leaves at the end of the case and they're left alone. So we want them to be connected to community supports. We want them to be connected to informal supports, which will obviously prevent them from coming back into the system. And so now I'm going to just talk a little bit about my experience with the child welfare system.
Early engagement in services will help parents gain the skills, insights, and capacities to keep their children safe, which will result in a more timely family reunification and enhance the well-being of children and their families.
I'm also a mother that had my children removed and had been successfully reunified with my children. Reunification of families is especially close to my heart. Because of that, that's my passion. I want to create the same experience that was made for me and my kids. When I look at the success of my family today, I owe it to the people that believed in me and really took the time to get to know me and see something in me that I wasn't able to see in myself. The feeling I had of despair, fear, hopelessness will be my guiding force forever to influence change and impact the success of families. Parent partners support families in a way that is non-judgmental and are able to hold them accountable using their experience to guide them. There is an instant connection between families and parent partners that is undeniable. This connection assists families in engaging in services, fulfilling their case plan obligations, and understanding the processes and removing the fear associated with working with the system. Now, as a service area parent partner coordinator, I not only get to see the successful outcomes of early engagement and supportive interventions for families, but I also have the opportunity to watch our parent partners working side by side with workers to support reunification, as well as the safety, permanency, and well-being of all children within child welfare. I think part of my success, and I owe it to a system that supported me long after I left care or having my kids in care. They supported me to develop my professional skills, to go back to college, to get that degree, to move into administrative roles and coordinator roles, and I want to replicate that for more families. I want the experience that my family had of being reunified and seeing them today as my children are doing amazing, building healthy lives, have broken the cycle of addiction, moving on, building families, buying homes, going to college, all them things we want to duplicate for other families. And I was lucky enough to have that, and that's why I do this work, and that's why I believe in this program so much, is and want to support Parent Partners in such a big way, because it's done so much for my own life, and I see it impacting families in such a wonderful, amazing way. And Corey, do you want to share a little bit?
Sure. Well, thank you for that heartfelt and courageous story you just shared. I like to believe that, you know, when I think of the parent-partner approach, I look at it as if, you know, it's saying to me that risk factors are not predictive factors due to the presence of protective factors. Parent partners are protective factors for all of our parents that we work with. As we talked about the criteria and the requirements for a parent partner, I too have been involved in the child welfare system in the past. I too suffered from addiction, and in June of this year will be 9 years clean and sober, including weekends and holidays. However, it wasn't always easy for me with challenges and hardships to achieve goals that I really in my heart wanted to achieve. It wasn't until there was one caring soul that asked me about gratitude, and he asked me to write something about that. That one caring soul instilled in me that I had a lot of reasons to be grateful, that I had a lot of life to live, and that he would help me get through whatever challenges I was going through at the time. In spite of all despair, as Denise mentioned, desperation, grief, guilt, trauma, toxicity, violence involved in my life, I was able to rely on his mere words that you are somebody, and don't let anybody tell you any different. That view of me then, I did not possess myself. It took someone else to look at me and say, you are something, and please recognize that within yourself. I implore everyone who's listening today to be that face, to be that smile, to be that handshake, to be that one person to lean on for another family. Those types of skills we cannot teach. Those types of skills are in us all, and those are the things that families who have more critical needs than you and I, those are the things they need to get to the next level, and hopefully that level is reunification. I thank you all today for hearing us, for your time, and I'll turn it over to Jennifer for questions and answers. Jennifer?
Thank you. And thank you, Corey and Denise, so much for your wonderful presentation, and thank you very much for sharing your personal stories. We wanted to open it up now for question and answer, and we've received several questions through the chat feature, so if folks have questions, please feel free to type there, and so I'll start with some of the ones that have come in. So Corey and Denise, somebody wrote that they're familiar with the Iowa program, but I think both of you can answer this question. They're wondering if you can talk about how you've been involved in policy changes and other groups at the state level.
Well, this is, Denise and I both can talk to this. In my state, I have attempted to organize around a lot of policy changes. As we know, most of the mandates by the state often restricts the good work that we want to do on the ground level. Most recently, we've tackled the issue of background screening. And when I say that, we have a list of criteria that requires a certain level of screening to take place, Jeffrey. And also with that, it sort of restricts parents who have lived experiences from working with other parents. So we're working with the state to really identify ways of allowing parents to do this work, because if we've been involved in the child welfare system, there's a more than 50% chance that you've had some run-in with the law as well. You add alcoholism and substance abuse to that equation, then you're almost guaranteed to have some exposure to the criminal system, to the judicial system. In Iowa, they actually accomplished that feat through their Department of Human Services and they have a letter of understanding that they're able to contract with parents who have felonious backgrounds, depending upon what the conviction was. And in Florida, we're trying to really highlight how can we continue to work with parents, because if we're discussing equal partnerships, professional development, and paving a way for future employment, that is one policy that's a legislative one that we must begin to address as a country, because it will eventually become a hindrance for further involvement and isolate so many of our community who has the wealth of knowledge to help in this approach.
And I would just add to that as well, our child welfare agency administration is amazing about including parent partners at all different levels of our system. So we have parent partners on any issue that happens. We have a statewide initiative for reducing disproportionality. So we have families or parent partners of color that are representing parent partners on each of their committees. When we had our CFSR, each of the work groups, when addressing the CFSR, all had parent partner or parent representation at the table. When we went through differential response, we had parents at the table. We have parents and the youth voice out throughout our whole entire system. And if we're working on different things, family engagement, anything that the system is having an issue with, or if they're not just, or they're just expanding it, parents are always at the table. So we're involved in all kinds of policy work. We also do a lot of work nationally, of course, too, on developing policies that support family reunification and the parent partner program as well. So, yeah, it's a big piece of it. But our parent partners are also, I think, even when we were developing and implementing the parent partner program, so much was about the story. I mean, all of our parent partners have these beautiful, amazing stories of resiliency and overcoming barriers, and they're able to come back and share that kind of experience with the system, with what works well, what can we duplicate for other families, and what do we need to work on still. And I think that's the kind of approach that we've had with policy.
I hope that answered your question.
Thank you. The next question is, how do I get more information on the Family Empowerment and Leadership Academy? And I can answer that. It is planning to go live in July on the Center for State's CapLearn site, which is where our learning experiences go. And when it's ready to launch, we'll be sending information out through our listservs. And if you want to email me, Jennifer Marcelli, you'll see my contact information at the end. I'll be happy to get you on a list to ensure we send that information out when it's available. So the next question for Corey and Denise, what is the maximum time a parent can be involved with the Parent Partner Program?
Well, our parent partners go through the life of the case with the family. So they go all the way through permanency, and then we also touch back a month or 30 days out after the case closes just to make sure that everything's okay, and they still have supports in place, and then informal supports are helping them. But I think, you know, the connection that parent partners and families make with each other, it's really hard to say, okay, your case is closing today, I'm never going to talk to you again. So our parent partners build a relationship. It's such an emotional connection that it might not stop at that point. But as far as our program goes, it goes for the life of the case.
And if I may just chime in quickly, I see we have a lot of questions. We also intentionally attempt to cultivate new leaders. So as parents reunify, case closes, from that very moment we link them back into the resource center, which we call Family Place in our community. Through that, parents become active, they're giving back to the community, they're receiving training, and actually on the road to become parent partners, because our vision is pretty big, and we're hoping that our pilot program will continue through, you know, the next few years and beyond. So it's a way of, once case is closed, basically, it's a way to identify potential leaders to help carry the work forward.
Great, thank you so much. The next question is, what are the requirements to participate in the program? Are there parents that are not allowed to participate in the program, and what are some of the reasons why not?
I'm going to say that's it's challenging. Willingness is a huge part of it, of course, just like with anything. There are no restrictions. I've worked with parents who have had egregious abuse allegations, and the goal may not be reunification. The goal may be permanency. Yet and still in our community, we feel that we should actually try to support parents, even if reunification may not be the goal, because if we can provide mental health services, substance abuse treatment, and help to derail the train, then we'll do our very part in our community. So for the past 3 years, I'd say no, there are no restrictions for parent-partner engagement, and I don't think that, I'll let Denise speak to what Iowa does.
I guess I'm confused by the question. So does that mean to be a part of the program or to be a parent partner? What are the restrictions? I'm not sure. Jennifer, can you clarify what that means?
Yeah, I'm thinking that they're asking for a parent going through the child welfare system, but we can see if we can get clarification from the person who answered the question. But I think it's about parents participating as a mentee in the program.
Okay. Yes, there's definitely no restrictions. And I think that what is shocking to some of the parent partners is, like, if you come in with a substance abuse issue and then you know, the first time you work with a family that has physical abuse, some of that can be traumatizing for the parent partners, and that's why we have so many supports in place and so many ways to support them through that process, through the clinical, through our leads, through our coordinators, because our parent partners work with everything, physical, domestic violence, mental health. Some of them have sexual abuse. Some of our parent partners, we have a really open relationship. So if it's something that that parent partner doesn't feel they can work with, then we're able to reassign that if there's a conflict of interest with the family. But besides that, we work with our families.
Thank you. And the next question, I'm going to lump with another question that was asked about implementation. So number one, is the program designed to be implemented statewide, or can an agency start this? And a related question is, how long does it take to implement statewide from pilot to full implementation?
So I'll let Denise pick up on the full implementation, and I'll tackle the agency statewide portion of that question. As mentioned in this presentation, we planted some seeds here today, and hopefully you'll be able to nurture these seeds and recognize that you have autonomy. We'll have a framework and some tools to utilize through the center. However, it's a community's uniqueness that makes the program what it is. The program does not have to be implemented in any particular order, meaning it doesn't have to be statewide. Recognize that the ultimate challenge is to get statewide buy-in. So we have to start at the community level first. We have to show that there's some validity in the work within your community. And I'll also tell you from personal experience that this work is being done in your community by parents as we speak. We just haven't identified them. There's a resource mom in the neighborhood that's helping a mom get through a child welfare case plan right now as we speak. There's a mom supporting another mom in court as we speak, linking her to resources. So there's a few best practices that we'll have in the future for you through the center, but I do believe that it's the agency, whether it be nonprofit, child welfare, court component, those are critical, but it happens on the ground first, usually, and then we get statewide without buy-in. Denise?
And I agree. I couldn't agree more. We started as 4 pilot sites, and our programs looked very different. And until we went statewide in 2013, we had I think 18 or so different programs with different agencies in different communities, and so it looked very different. Our child welfare agency wanted state consistency and also wanted all families to have access to parent partners, so that's when we went into a statewide, went into all the counties, which it took approximately about a year and a half to go to full implementation, but there had been so much groundwork done. We started in 2007, and we didn't go statewide until 2013. But in the meantime, there was many different little programs across the state, and some larger programs across the state, but they were all funded differently, and they all had different training requirements, so there were some things that were standardized throughout the process, but for the most part, they were different, and our agency wanted to have it consistent for all families in all counties. I hope that answers the question.
Yeah, thank you so much. We did get clarification that the last question was about being an actual parent partner. So I'll let you answer the question about if there are any reasons why somebody cannot be a parent partner, as well as there's a question that's related around, does a parent partner need to be a professional or have a degree?
Okay, so anybody can be a parent partner unless they've been convicted on the death of a child or sexual abuse, I think, is the restrictions on some different programs. So it's going to, as you develop your own parent partner program, you're going to want to make your own restrictions on whatever you feel fits your community and the needs of your families. As far as like, we have parent partners that have had their rights terminated, and they're amazing parent partners. So it's really just overcoming the obstacles that brought you to the attention of the department and being able to come back and mentor other families. And having that compassion and empathy for families. They don't have to have a degree. We have parent partners that are some of our best parent partners have not graduated from high school. So, but it's moving to a coordinator position to advance in the program, you would need to go for a degree. But our parent partners are amazing at all different levels of education. It's really not the educational requirement they need. It's really the experience with the system, because they're really just creating an understanding of what's happening and helping families to understand the system, what's the next step, and helping them get to more successful outcomes.
So before we move to the next question, I think it's critical just to back into that one just a little bit more. And, the criteria, I believe, can vary from state to state, depending upon your jurisdiction. However, I think, it's to be credible, to remain credible. It's safe to say in our community, we will not emphatically, we will not entertain a parent partner who has a sexual conviction of a child, adult, any vulnerable children or adults. We will not employ anyone with that kind of background. So that hopefully that answers your question a little bit. When it comes to the length of being sober, that's up to the community. How many years you would like to see a parent partner show good moral character, that's something that can be up to the community. How many years since an arrest, things like that. But I think we're going standard here in our community that certain things we'll just won't entertain.
Thank you. We have a couple more questions and a couple more minutes. So first we had a comment from Heather Davidson saying that she would say a parent partner being at a pre-service training for foster parents helps the applicants know that the parents of the children they may serve are not scary people, and it helps them to understand the other side with the parent who has lost their children. So I just wanted to say that, and leading into the next question is about training, and I know you guys briefly covered it, but there's a question around what training do parent partners receive and through whom?
So in our community, we are once again in the early implementation phases. I've been certified in various trainings across the country, and the standard we're attempting to develop a certification process for parents. And through that certification process, we have identified a few core trainings. One being the training in the protective factors. Two, training in trauma-informed systems and responses. Futures Without Violence that helps paraprofessionals work with parents or families who have been exposed to domestic violence. Denise mentioned Dependency 101. We've created a brief training in our Dependency 101. We also have motivational interviewing and ethics and boundaries as our core components for training parent partners. And with that, of course, some of the soft skills we just cannot learn or teach in a classroom setting. So a lot of it after the certification process will be ongoing coaching back to the supervision and the leadership that Denise mentioned. And mandated reporting as well.
Great. Thank you, Corey. And the final question we have is, are you aware of models where a parent provider or support agency like Family Corps has a parent coordinator co-located in the child welfare agency?
Well, can you repeat that one more time? Yeah. I think, yeah.
Sure. Are you aware of models where a parent provider support agency like Family Corps has a parent coordinator co-located in the child welfare agency?
When we started, I was on AmeriCorps. I started over. We were located at our child welfare agency. Our whole program was. So I think that it would be beneficial because then you can build in relationships and build trust. One of the best aspects I think of us having a program over there was just the relationship between our social workers and our parent partners. We were really building the relationships with our frontline workers. We're so invested in the success of the program. So I think there's a huge benefit to having them at the agency. I know in New Hampshire, they have it out of the child welfare agency, and it's very effective, and it's wonderful work for the parent partners and for the families they're working with. So absolutely, it can be both ways. I think when you separate from the child welfare agency, that communication just has to be intentional, that you're reaching out and that you're making them connections with your workers and your child welfare agency to be effective. But if you're already there, then it happens naturally, then connections and then relationships.
Great. Well, thank you so much, Denise and Corey. And if we weren't able to answer all of the questions today, we will absolutely get back to all of you participants after the webinar and respond to those questions. So we're going to go ahead and wrap up. I want to thank you from all of us at the Center for States and the Children's Bureau and Corey and Denise for participating on today's webinar. Next slide, please. I do want to remind folks that on the bottom right hand of your screen is a little box where you're able to download the PowerPoint presentation from today. Up on the screen, we have the contact information for those of us on the webinar today. Myself, Jennifer Marcelli from the Center for States, and you can reach me at jennifer.marcelli@icfi.com. Taffy Compain from the Children's Bureau, taffy.compain@acs.hhs.gov. Corey Best at corybest@rocketmail.com. And Denise Moore, Denise M. at cfiowa.org.
The email addresses to contact the presenters are as follows. Jennifer can be reached via email at jenn_marcelli taffy.marcelli@icfi.com. Taffy's email address is taffy.compain@acf.hhs.gov. Corey Best from Healthy Start Coalition of Flagler and Volusia Counties Incorporated can be reached via email at coreybest@rocketmail.com. Denise Moore from Children and Families of Iowa can be reached by email at denisem@CFIOWA.org.
And next slide, please. We would absolutely like your feedback on our webinar today, and if you can take a few moments to share your thoughts, you will see a link in the PowerPoint, and we will also be sending out the evaluation link to all of you following the webinar.
A link to the survey is provided on screen, but the survey is now closed.
In 24 hours. And you'll also get an email reminder about the CEU information as well. And all results are confidential and just help us improve future programming. A couple more things I want to mention. Please visit the National Foster Care Month website on the Child Welfare Information Gateway. And the last thing is you can contact us, the Center for States, at capacity.childwelfare.gov.
The email address for the Capacity Building Center for States is capacityinfo@icfi.com. The phone number is 844-222-0272.
Please join us back on May 18th. We'll have our second National Foster Care Month webinar on post-reunification support, and that will be again at 2 Eastern. Thank you, everybody, for participating today. We appreciate your time.
That does conclude today's conference. We thank you for your participation.